First at 6, breaking news from the Target 12 investigators. A federal investigation has found the state's child welfare agency violated the civil rights of hundreds of children.
The U.S. Attorney's Office says the state routinely warehoused kids with behavioral disabilities at a psychiatric hospital some months on end.
Target 12 investigator Tim White was at a news conference that wrapped up a short time ago and joins us from Providence with the investigation's findings. Tim?
The federal investigation found hundreds of these children were admitted to Bradley Hospital in East Providence, some staying for more than a year.
The state of Rhode Island has failed miserably and repeatedly.
U.S. Attorney for Rhode Island Zachary Cunha says a 2-year federal investigation found Rhode Island's DCYF would routinely send children with behavioral disabilities, some as young as 4, to Bradley Hospital, often for months and even in some cases for more than a year.
To think that too many children with mental or developmental disabilities have been treated as something to be relegated out of sight in a psychiatric facility, it breaks the heart. And more to the point that we're here for today, it breaks the law.
In 2020, Target 12 first revealed the practice and how kids were not receiving an education as required by law. At the time, we talked to Paul Shappett, a behavioral health specialist at Bradley.
The kids have to have a voice. Somebody has to step up to the plate and say, this is not okay.
State Rep Julie Casimiro says they have been waiting for the state to build 2 facilities to help with the problem.
We as a state pull these kids from their homes because we think we can take better care of them, and then we fail them every single day.
I'd like to see concrete examples of what the state intends to do to fix this problem.
Cunha says DCYF has 10 days to respond to their findings and must come up with a plan to fix it, or his office will file a lawsuit.
The problem is the use of hospitalization when less restrictive means are available and necessary, like community care, like therapeutic foster care, settings that don't involve actually confining a child to a hospital.
Cunha stressed there was no wrongdoing on the part of Bradley Hospital. He added sometimes staff there would ask the state to find different placement for these children, but often the state wouldn't do it. In Providence, with the Target 12 investigators, Tim White, 12 News.